Sustainable Development Goals or SDGs is a global plan agreed by global leaders, including Indonesia, to end poverty, reduce inequality, and protect our environment. The SDGs contain 17 goals and 169 targets that are expected to be achieved by 2030. The Sustainable Development Goals or SDGs were born at the United Nations Conference on Sustainable Development in Rio de Janeiro in 2012. The objective was to produce a set of universal goals that meet the urgent environmental, political, and economic challenges facing our world. The SDGs replaced the Millennium Development Goals or MDGs, which started a global effort in 2000 to tackle the indignity of poverty. The MDGs established measurable, universally agreed objectives for tackling extreme poverty and hunger, preventing deadly disease, and expanding primary education to all children, among other development priorities. For 15 years, the MDGs drove progress in several important areas, including reducing income poverty, providing much needed access to water and sanitation, driving down child mortality, and drastically improving in maternal health. They also kickstarted a global movement for free primary education, inspiring countries to invest in their future generation. Most significantly, the MDGs made huge strides in combating HIV/AIDS and other treatable diseases such as malaria and tuberculosis. The legacy and achievement of the MDGs provide us with valuable lessons and experience to begin work on the new goals. But for millions of people around the world, the job remains unfinished. The SDGs are also an urgent call to shift the world into a more sustainable path. The SDGs are a bold commitment to finish what we started and tackle some of the more pressing challenges facing the world today. All 17 goals interconnect, meaning success in one affects success for others. Dealing with the threat of climate change impacts how we manage our fragile natural resources. Achieving gender equality or better health helps eradicate poverty, and fostering peace and inclusive societies will reduce inequalities and help economies prosper. In short, this is the greatest chance we have to improve life for future generations. The SDGs are a much more comprehensive sharing commitment than the MDGs. The emphasis on goals is not only on the outcome of development itself, which leads to an increase in welfare, but also on the aspect of justice and inclusiveness as well as the way in which the goals are achieved. The SDGs emphasize the fulfillment of human rights, non-discrimination, attention to the marginalized and disabled, the importance of participation of collaboration of all development stakeholders, include government, business, NGOs, universities, and the community. If in the MDGs there are targets to reduce by half, for example the poverty target, then in the SDGs the targets are agreed to be much more ambitious, namely eliminating poverty in all its forms. The SDGs strongly encourage wider development cooperation among stakeholders, not only at the local and national levels. The SDGs provide a broad space for global development cooperation among stakeholders, not only between governments. Included in this global development cooperation mechanism are in the terms of funding, capacity building, human resources, technology transfer, and market access. Indonesia is a country on the move. In the last decade, it has made important progress toward the targets of the Millennium Development Goals or MDGs. Indonesia has graduated to middle income country status and joined the fold of the G20's major advanced and emerging economies. Indonesia is the largest country in the Association of Southeast Asian Nations or ASEAN. To ensure UN's presence in Indonesia is most effective, Indonesia are partnering with both the government and private sector to achieve the sustainable development goals together. A good health and well-being is a continuation of the goals in the MDGs. Globally, the MDGs still leave unfinished business in this goal. So that means the implementation of this goal in the MDGs faces considerable many challenges in most countries. For Indonesia, this health goal is very important because Indonesia will have the potential for a demographic bonus in 2022 until 2030. If we fail to implement Goal 3, Health and Goal, and 4, Education, it is possible that bonuses can become a demographic burden. If this happens, it will interfere with the achievement of sustainable development. Although, in order to build the realization of sustainable development, the development of healthy and intelligent human resources, as well as having tolerance and responsibility for the planet, is a very important factor for all pillars of sustainable development. COVID-19 in Indonesia, starting from a Japanese citizen who has attended the dance party with multinational participants and was finally confirmed to have tested positive COVID-19. On Monday, August 9, 2021, as many as 3,600,000 Indonesian citizens have contracted COVID-19, and 106,000 of them have died. The COVID-19 outbreak has proven to have taken a large number of lives and have certainly disturbed the citizens of the world. This is a warning for all of us to continue to cooperate with the government in breaking the chain of transmission of COVID-19, one of which is by implementing 5M. With the right amount of alcohol is between 60% and 80% can be effective to eradicate virus. That is why the use of hand sanitizer with high alcohol content are needed in the middle of the COVID-19 outbreak. Additionally, in the document frequently asked questions regarding the implementation of the COVID-19 vaccination, which was uploaded on the official website of the Directorate General of Public Health of the Indonesian Ministry of Health, it was explained that vaccination COVID-19 did not make us 100% safe from COVID-19. However, the COVID-19 vaccination will reduce the impact of COVID-19. Finally, an experiment conducted by a team in Hong Kong found the rate of transmission of COVID-19 dropped by 75% when medical masks were used. This indicates the importance of continuing to wear masks to reduce the risk of transmission of COVID-19. Therefore, we are KKN 241 Erlangga University Balas Kumprik have success in distributing hand sanitizer in 12 public spaces, which are assumed to be places for interaction with many residents. In addition, we also distribute medical masks to residents who still don't use masks when they leave the house, and we also provide counseling on the importance of vaccine to residents around the Balas Kumprik. We're doing all these activities as a form of our commitment in helping the government to achieve good health and well-being goals. Hopefully, what we have done can have a positive impact on the health of the Balas Kumprik community in the future. Let's together help the government break the chain of handling this COVID-19 outbreak by at least doing 5